My name is Khaled Ibrahim, MPPS in Indian University, Master of Human Anatomy, National University. Today we are going to talk about the pelvic region. We will start firstly by osteology, then the wall of the pelvis. Also, we will talk about the contents of the pelvis regarding the contents, which are the genitalia, internal organs of the reproductive system, and also we will take a brief talk about the urinary system and the organs of the urinary system that are located within the pelvis. First of all, in this session we will talk about the osteology of the pelvis. We will start by the pelvis consists of many bones articulated to each other. For example, we have two hip bones or innominate bones, the right one and the left one. This is the anterior aspect of the pelvis and this is the posterior aspect of the pelvis. The two hip bones articulated anteriorly to each other with symphysis pubis anteriorly. The two hip bones articulate with the sacrum posteriorly to form two sacroiliac joints, the right one and the left one. Posteriorly, we have this bone which is the sacrum. This is the sacrum. Inferior to the sacrum will articulate with the coccyx. First of all, we will talk about the hip bone. We will look at the right hip bone. This is the hip bone or innominate bone. The upper part of the hip is called the ilium. The anterior inferior surface is called the pubis. The posterior inferior part is called the ischium. This is the hip bone, the right one. This is the ilium. This is the pubis, and this is the ischium. In the ilium, this surface is called the iliac fossa. This is iliac fossa. This is the iliac crest. And this is the gluteal surface of the ilium. Anteriorly in the ilium, we have this prominent area which is anterior superior iliac spine. This is anterior inferior iliac spine. Posteriorly, this is the site of articulation with the sacrum to form sacroiliac joint. This is a posterior superior iliac spine. This is posterior inferior iliac spine. Posterior inferior iliac spine. In the pubic, this area is called the pubic ramus. This is superior pubic ramus, and this is the inferior pubic ramus. Superior pubic ramus. This is inferior pubic ramus. This projection or this tubercle is called the pubic tubercle. Pubic tubercle is the area of attachment of the inguinal ligaments. The inguinal ligaments runs from the pubic tubercle to the anterior superior iliac spine or axis. This is the ischium. This is ischial tuberosity, and posteriorly this spine or projection is called the ischial spine. The ischial spine. The ischial tuberosity is the area where we sit on. This foramen is called the obturator foramen. Usually it's filled with obturator membrane. Again, this is the ilium, this is the ischial tuberosity, ischial spine. This is the inferior pubic ramus, the superior pubic ramus, the site of articulation with the other hip bone, site of the symphysis pubis. This is the acetabulum, which is the site of articulation with the head of the femur to form the hip joint. This is a bony pelvis articulating with the vertebral column. This is the anterior view or anterior aspect, this is the posterior aspect. So these are the two hip bones. This is the symphysis pubis. This is the lower lumbar vertebrae posteriorly, and this is the sacrum. In the pelvic region, we can divide the pelvis into two regions. The area superior or above the pelvic inlet or pelvic rim, this area is called the pelvic inlet. The area above this region is called the false pelvis or true pelvis. The area below the pelvic rim or pelvic inlet is called the true pelvis or lesser pelvis. In the lesser pelvis, we will find the genitalia, we find the bladder and rectum and other part of the GI. This opening below in the pelvis is called the pelvic outlet. Again, this is a pelvic inlet and this is the pelvic outlet. Pelvic inlets boundaries anteriorly, symphysis pubis, posteriorly the sacrum, and laterally the hip pulse. There are many differences between the pelvis in the female and the pelvis in the female regarding the opening, regarding the pubic arch, regarding the pelvic outlet, regarding the length, regarding the shape of pulse. There are many differences. You have to know these differences between male and female. Posteriorly, we have this bone, which is the sacrum. The sacrum consists of 5 vertebrae fused to each other. Anteriorly, this area of the sacrum is called the sacral promontory. This is called the ala of the sacrum. Sacrum articulate in the right and left hip bone to form right and left sacroiliac joint respectively. The posterior aspect of the sacrum, we have this crest, is called the medial sacral crest. And we have foramen or foramina posteriorly, which called posterior sacral foramina. Anterior also, we have anterior sacral foramina. Here in this area, we will find the intermediate sacral crest, and laterally we will find the lateral sacral crest. Here we will find the which called the sacral hiatus. The sacrum is articulated inferiorly with the coccyx. The coccyx is the distal part of the vertebral column, usually about 3, 4, or to 5 vertebrae fused together to form the coccyx. That's all about the osteology of the pelvic bones. In the pelvic region, regarding the pelvic wall, we have muscles located laterally, and we have the muscles which form the pelvic floor. The muscles that form the wall of the pelvis are the obturator or internus, which originate from the inner side of the obturator membrane and adjacent bones. And also we have the piriformis, which is not found here in these mannequins. And also we have the coccygeus. So we have the obturator internus, we have the piriformis, we have the coccygeus, and in the pelvic diaphragm we have these muscles, large muscle, which is levator ani muscles. Levator ani actually is a group of muscles from the pelvic diaphragm, called the pelvic diaphragm. The muscles that form the levator ani are the pubococcygeus, iliococcygeus muscles. Some fibers went around the rectum to form puborectalis, pubococcygeus, and iliococcygeus. These muscles form the levator ani muscle, which form the pelvic diaphragm. Below the levator ani, we will find the perineum. This is the posterior aspect. This is the sacrum, as we mentioned. This is the right and left hip bones. This ligament, which runs from the sacrum to the ischial tuberosity, is called sacroischial ligaments, and we have this ligament which is called sacrotuberous ligament. The sacroischial ligaments and sacrotuberous ligaments convert the lesser and greater and lesser sciatic notch into greater sciatic foramen and lesser sciatic foramen. These two ligaments are very important in the pelvic region. Also, we have another ligaments. For example, we have ligaments, very strong ligaments located in this area. It's called posterior sacroiliac ligaments, and we have also anterior sacroiliac ligaments. Again, this is called sacrospinous ligaments, and this is called sacrotuberous ligaments. In addition to these ligaments, we have the posterior and anterior sacroiliac ligaments. Below the pelvis, we will find the perineum. The perineum is the area that located below the pelvis or below the pelvic diaphragm. The perineum, boundaries of the perineum Anteriorly, we have symphysis pubis. Posteriorly, we have the coccyx. Laterally, we have the ischial tuberosities. The perineum is a diamond-shaped area located below the pelvic diaphragm. We can divide the perineum by imaginary line from the two ischial tuberosities into anterior triangle and posterior triangle. So anterior triangle is called the urogenital triangle, which contains the genitalia in male and female, and the posterior triangle, which is larger, contains the anal canal, is called anorectal or anal triangles, also contains the ischiorectal fossa. Again, the perineum is the area that located below the pelvis. It is diamond in shape. The boundaries posteriorly coccyx, anteriorly pubic symphysis, laterally two ischial tuberosities. Imaginary lines from the two tuberosities divide the perineum into anterior urogenital triangle and posterior anal or anorectal triangle. In the perineal area, we have two very important pouches. The first one is the superficial perineal pouch. Actually, the superficial perineal pouch is located between the perineal membrane and superficial perineal fascia. What are the contents of the superficial perineal pouches? We have muscles, we have nerves, and we have the external genitalia in the male. In the female, the contents of the superficial perineal pouch also muscles, nerves, branches from the pudendal, roots of the penis, testis, and spermatic cord. These mannequins represent the female organs. This muscle is one of the muscles of the superficial perineal pouch. Is called pulpospongiosus muscles, and this muscle is called the ischiocavernosus muscle, and this muscle is represent the superficial transverse perineal muscles. Left one, right one, and the left one. Again, this area represents the superficial perineal pouch. This is the labia majora, labia minora, and vestibules. This is the clitoris. This is the ischiocavernosus muscles. This is the pulpospongiosus muscles, and this is the superficial transverse perineal muscles. In addition to these muscles, as the external genitalia of the female, also we have nerves and vessels. Also, we have another pouch called the deep perineal pouch. The deep perineal pouch usually is not illustrated here. The deep perineal pouch is between the area between the two layers of the diaphragmatic perineal membrane, between the two layers, between the two fascia. What are the contents of the deep perineal pouch? Contain the deep transverse perineal muscle, also contains the external urethral sphincter muscles. It's called internal or urethral sphincter or sphincter urethral. Also, the pulpourethral gland in the male is one of the content of the deep perineal pouch, not the superficial perineal pouch. In addition to these structures, we have the branches from the pudendal vessels, branches from the dental nerve and pudendal vessels. All the muscles of the perineal pouches are innervated by perineal branches from the pudendal nerve, Let's go to talk about the organs, internal organs of the pelvic region. This pelvic area is represent, this mannequin represents the urinary bladder. This organ, which posterior to the urinary bladder, this is the rectum. These vessels represent the external iliac vessels. This is the external male genitalia, the penis, gland of the penis, two testicles or testes. This is the spermatic cord. The testes are covered by the scrotum. When we remove this part of these male mannequins, we will see clearly the urinary bladder. Urinary bladder is superiorly covered by the pelvic peritoneum, anteriorly it is related to the pubic symphysis or symphysis pubis. Posteriorly it related to the rectum. This is the external genitalia, as we mentioned, penis, gland of the penis, spermatic cord, and the contents of the spermatic cord, the left testis, right testis, and the scrotum cover both testicles. When we divide these manicons into left sagittal plane, we will see the bladder, urinary bladder clearly. This is the urinary bladder. Urinary bladder is a pyramidal in shape. It has the apex which located anteriorly in relation to the symphysis pubis. This symphysis represents symphysis pubis, and the base which located posteriorly, which related to the rectum. The muscles of the urinary bladder is called the detrusal muscles. The bladder has two surfaces, superior surface and two inferior lateral surfaces. The bladder superiorly is covered by the peritoneum. Inside the bladder, we will find a lot of mucosal folds. Posteriorly, we will find the area which is not clearly seen here, which is strigon. Strigon is the least mobile area, and the smooth area is the urinary bladder. As we mentioned, the apex of the bladder is directed forward, and the base of the bladder is directed backward. Function of the bladder is to store the urine till the reflex of voiding or urination. Regarding the blood supply of the urinary bladder, most of organs of the pelvis are supplied by branches from the internal iliac artery. Branches to the urinary bladder are superior and inferior vesical arteries. Regarding the innervation, parasympathetic and parasympathetic innervation. Here we will find the neck of the bladder. Below the neck of the bladder, we will find this organ, which represents the prostate gland. Inferiorly, we will find the urethra in the male. The urethra in the male is subdivided into many parts. This part of the urethra is called the prostatic urethra. This part of the urethra in the pelvic or the diaphragm or membrane is called membranous urethra, and the rest of the urethra is called spongy or penile urethra. The distal part in the glands of the penis urethra will dilate it to form navicular fossa. Again, the urethra is subdivided into prostatic, membranous, which is the shortest one, and the penile urethra, which is the longest one. The length of the urethra in male is approximately about 17 to 18 or even to 20 centimeters. Blood supply of the urethra usually branches from the vesical arteries, specifically inferior vesical artery. The function of the urethra in the male is to convey the urine from the bladder outside the penis to external environment, also to convey the semen in the process of ejaculation. There are many problems that may occur in the urinary bladder. For example, inflammation, which is called cystitis, stone, which is called vesical stones. Also, cancer you can develop in the urinary bladder, which is called usually transitional cell carcinoma. Transitional because the epithelium of the bladder or urinary bladder is a transitional epithelium. Usually, the empty bladder is located in the pelvis, but the full bladder it can reach to the abdominal region. Again, the name of the muscles in the bladder is called the detrusal muscles. Inferior to the bladder, this is the prostate gland. The bladder is one of the organs of the urinary system. Also, urethra, one of the organ of the urinary system, and also one of the parts of the reproductive system. Regarding the prostate gland, which is located inferior to the urinary bladder, is one of the accessory glands in the reproductive organ. The function of the prostate gland is to secrete the healthy alkaline fluids contribute in the semen and in the ejaculate. It has many lobes. It has a fibromuscular part and also it has granular part and stroma. Have the medial zone and lateral zone. Usually or clinically, the the prostate can enlarge in the elderly people. The enlargement could be benign, called benign prostatic hyperplasia, or could be due to cancer. Usually cancer originates from the peripheral zones of the bladder, of the prostate, and the benign prostatic hyperplasia from the medial zone of the prostate gland. Regarding the blood supply of the prostate by prostatic branches, also from the internal iliac artery. Regarding the venous drainage by prostatic venous fluxes, also drain to the internal iliac vein. Innervation, also autonomic innervation. In the prostate gland, we will find the prostatic urethra. The prostatic urethra also received the ejaculatory duct. The ejaculatory duct, which formed by the union of the ductus deferens or vas deferens with the seminal vesicles duct. Seminal vesicle ducts with ductus deferens or vas deferens form the ejaculatory duct, which drain into the prostatic urethra. In the external genitalia of the male, this is the penis again. This is the body of the penis, and this is the glands. And inside the pelvic, we will find the roots of the penis. This is the testis. The right one. The right one is located in the scrotum. The development of the testis started in the abdomen and then descend toward the scrotum. Any abnormality in the process of descending of the testis will result in undescending testis or cryptorchidism. Testis may be found in many areas, specifically in the inguinal part. This is the superficial ring of the inguinal canal, and here we will find the inguinal canal. And this area in the blue color represents the spermatic cord, which contains a lot of structure. For example, testicular arteries, pambiliform plexus, vas deferens, and other nervous branches and other parts or other structures of the spermatic cord. The function of the testis is to produce the sperms. The sperms actually produced inside the testis in the seminiferous tubules. The other function of the testis is to produce the sex hormone in males, specifically testosterone. Blood supply of the testis by lung artery, testicular artery, or gonadal artery, which originate from the abdominal aorta just inferior to the renal artery. Regarding the venous drainage of the testis by testicular vein or pambiliform plexus, the left one will drain to the inferior vena cava, the right one will drain to the left renal vein. Usually, the testis is covered by capsule and tunica alvagina, and the outer part of the testis also covered by tunica vaginalis. The tunica vaginalis has two parts, parietal and visceral layer. Posterior lateral to the testis, we will find epididymis, which is not illustrated here. We will see it in the cadaver or other mannequins. The epididymis is located usually posterior lateral aspect of the testis. The organs of the urinary system are two kidneys, two ureters, left one and the right one, the urinary bladder, and inferiorly the urethra. This is the right kidney, and this is the left kidney, This is the left renal vein, and this is the right renal vein. This is the right renal vein, and this is the right renal artery. This is the ureter. We talked about the ureter in the previous session. This is the urinary bladder. Also, we talked about the bladder, but this is a different manicles. This is the superior surface of the urinary bladder. Here we will find the apex of the bladder, and posteriorly we will find the base of the bladder. The structures that related to the posterior aspect of the urinary bladder are two seminal vesicles. This is the right one, this is the left seminal vesicle, and this is the vas deferens. As we mentioned previously, the seminal vesicles and the ductus deferens or vas deferens will form the ejaculatory duct, which drain into the prostatic urethra. Prostatic urethra. These openings are openings of the ureters in the posterior, the superior lateral aspect of the urinary bladder. This area, these organs, this part represent the prostate glands. When we open the urinary bladder from the inside, we will find the trigon. This area represents the triangular area located in the posterior surface. It is a least mobile and smooth area. In the two superior lateral aspect of the trigon, we will find the opening for the two ureters, and in the inferior aspect of the trigon, we will find the opening for the urethra. This is the prostate gland, and this is the prostatic urethra. This part represent the ductus deferens or vas deferens, which brings the sperm from the testis to the urethra. This is the testis. Posteriorly, in the testis, we will find the epididymis. Again, this is the right and left kidneys. This is the left ureter, right ureter. This is the urinary bladder and urethra, organs of the urinary system. In this manicles, we have the ductus deferens, seminal vesicles, the prostate glands are internal organs of the male genital system. This manicle represent the external genitalia of the male, specifically the penis. The penis has many parts. This part of the penis is called the root of the penis. This part is called the body of the penis, and this part, which is located distally, is the glands of the penis. Inferiorly, in the penis, or the root of the penis, is a part of the superficial perineal pouch. In addition to the roots of the venous and testis and spermatic cord, also we have these muscles, which illustrated previously in the female manicles. This muscle is called pulpo-spongiosum muscles. This is called ischioclavicular muscles. In addition, we have the two pairs or two muscles of superficial perineal muscles, transverse superficial perineal muscles. Ischioclavicular, pulpo-spongiosum, transverse perineal muscles, testis, spermatic cord, coat of the venous. All these structures are contents of the superficial perineal pouch. When we divide the penis into two halves, the mid-cervical vein, this is the inside the penis, this is the gland of the penis, this is the body, and this is the root of the penis. This is the male urethra. As we mentioned previously, it links about 17 to 18 and even to 20 centimeters. The longest part of the urethra is called penile or spongy urethra. The smallest part is called the membranous urethra. It's found in the membrane or pelvic diaphragm, and the part which is located inside the prostate is called prostatic urethra. The urethra is found in the erectile tissue of the penis called corpus spongiosum. Also, we have two corpora cavernosum. The part is called corpus cavernosum, two corpora cavernosum, and one or single part of erectile tissue is called the corpus spongiosum. Regarding the blood supply of the penis, pipe branches from the internal pudendal artery. Branches from the internal pudendal artery. We have branch which supply the skin and the glands. It's called dorsal artery, dorsal penis or penile artery, branch from the internal pudendal. Also, we have artery to the pulp, which supply the corpus spongiosum, and we have deep penile artery. Again, dorsal penis artery or penile artery, artery to the bulb, and deep branch from the internal pudendal arteries. Regarding the venous drainage of the penis, the part of the penis drain into internal pudendal nerve. Regarding the innervation, the erectile tissues of the penis drain to the deep inguinal lymph nodes, skin glands drain into the superficial inguinal nodes. Regarding the function of the penis, is the organ of sexual intercourse, reproductive system. Also, the site which contains the urethra, which drains the urine to the external environment, also drains the ejaculate and semen into external environment or into female. That is all about the penis. Okay, this cadaver will look to the external genitalia of the male. This is the penis. This is the body of the penis, and this is the gland of the penis. And here we will find the external urethral meatus. External urethral meatus. And posteriorly, we will find the roots of the cadaver, which cannot be seen here, but it can be seen in the sagittal section. This is the scrotum, which is a muscular fibrous layer that surrounds the both testicles. This is the scrotum, and this is the testis. This is the testis, and this is the spermatic cord. This is spermatic cord connected to the testis. This is spermatic cord in the inguinal canal region, and inside this is the spermatic cord in the abdominal region. In the testis, as we mentioned previously, the testis is it has endocrine function which secretes the sex hormone, specifically testosterone. Also, it's a site of formation of sperm, the site of spermatogenesis. Site of spermatogenesis, actually, the sperms is formed or synthesized in the area inside the testis called seminiferous tubules. The testis is covered by layers. The layers that attach to the testis is called tunica albuginea. The outer layer is called tunica vaginalis. The tunica vaginalis has two parts, parietal and visceral layer. Posterior lateral is the testis. We have very important structure here, which we call the epididymis. The epididymis, it has body, head, body, and tail. The tail, which located distally, not proximally. The tail which continue with the vas deferens. The vas deferens, which is one of the contents of the spermatic cord. Again, this is the testis, the layer of the testis. This is the area where the epididymis located, head, body, and distally tail. The tail will continue with the vas deferens or ductus deferens. The function of the epididymis, the first function is to store the sperm. The second function is to give the sperm chance for maturation. So, to store the sperm till the ejaculation, also the site of sperm maturation, site of sperm maturation. Regarding the vas deferens or ductus deferens, which is one of the contents of the spermatic cord, is a pathway for sperm from the epididymis to the prostatic urethra through the ejaculatory duct. Again, this is a penis, this is the body, this is the gland of the penis, this is the external urethral meatus, this is the white testis. Posterior, you have the epididymis. This is spermatic cords, including the vessels, spermatic vas deferens, and other contents of the spermatic cord. Okay, let's take a look for urinary bladder and rectum in cadaveric specimen or in situ. This is the anterior abdominal wall. It's divided in the midline. This is the perineum. This is part of the perineum. This is the urinary bladder. This is the urinary bladder in the pelvic region. This is the urinary bladder located in the pelvic region. This is the bladder. This is the perineum covering the superior surface of the bladder. This is the sigmoid colon. This is the rectum. This is the rectum located in the pelvis. And this area is called rectovesical pouch. This area is called the rectovesical pouch. In the female, rectum is related posteriorly to the uterus, and the pouch or recess between the rectum and the uterus is called pouch of Douglas or rectouterine pouch. Again, this is a urinary bladder. Inferiorly, we will find the neck of the bladder. Anteriorly, here, this is area. This is the apex of the urinary bladder, and posteriorly, we will find the base of the urinary bladder. Actually, the apex of the bladder is connected with the umbilicus through the medial umbilical ligament, which is a remnant of the urethus. Here we will find the medial umbilical ligaments which connected to the umbilicus, which is embryologically remnant of the urethus. Again, in the cadaver, this is the abdominal wall, this is the urinary bladder, this is the rectum, this is the rectouterine vesical pouch, and this is the anterior part or anterior relation to the urinary bladder. In this area, we will find the symphysis pubis area. This is the symphysis pubis. In these mannequins, the female mannequins, here we will find the external genitalia of the female, and inside the pelvis we will find the internal organs, genital organs of the female. This part of these mannequins represent the uterus, and this area, this is the left and the right fallopian tube, and this area of this mannequin represent the ovaries. The uterus, fallopian tubes, two ovaries are represents the internal organs or internal genitalia of the female. The uterus is related anteriorly to the bladder and related posteriorly to the rectum. We will find two recesses. One recess is located between the uterus and the bladder, is called vesico-uterine or utero-vesical pouch, and we will find another recess posteriorly in between the uterus and the rectum. It's called rectouterine pouch, or its other name is pouch of Douglas. Pouch of Douglas is the area that filled with fluid when the patient, when the female is in a standing position. It's called the rectouterine pouch or pouch of Douglas. This area represents the external iliac vessels, artery and vein respectively. The structures that located in the external genitalia, the whole area is called the vulva. The contents or the parts of the vulva are labia majora, labia minora, Venous pubis superiorly, which contain the pubic hair, and you will find the vestibules and the clitoris. These parts or these organs or structures are called the external genitalia of the female. When we remove this part of this mannequins, we will see clearly this is the uterus, and this is the rectum posteriorly, and this is the area of pouch of Douglas. Again, this is the uterus, this is the anterior part, this is symphysis pubis, this is the right side, and this is the left side. When we divide these mannequins in the mid-sagittal plane, we will see this is the uterus, and this is the bladder, and this is the vagina, and this is the rectum. Again, this is the symphysis pubis. This is the urinary bladder in the female, and this is the uterus in the female. This is the vagina. The position of the uterus is anti-flex, anti-everted. It's anti-flex and anti-everted. Usually, it lies on the top of the urinary bladder. On the top of the urinary bladder. The uterus has many parts. This part here is called the fundus. This part is called the body, and this part we call the isthmus. This area, it will represent the uterine cervix. Represent the uterine cervix. Regarding the blood supply of the uterus by uterine arteries, which are branches from the internal iliac artery. Internal iliac artery. This is the urinary bladder again, and this is the female urethra. This is the female urethra. The urethra in the female is usually very short. It's approximately about 4 centimeters. 4 centimeters. This is the vagina. It's a muscular organ. It has anterior fornix and posterior fornix, which is longer, and 2 lateral fornices. This is the vagina. The function of the urethra in the female is to excrete the urine to external environments. The function of the vagina or vagina is so site of sexual intercourse, also the site for excretion of menstrual cycle clock, also is the Peyer's site of or organ of the Peyer's canal. Posteriorly to the vagina we have the rectum, and here we have the anal canal. Here is the anal canal and anus. This is the rectum. This is the vagina again. This is the uterus. This is the cavity of the uterus. This is the cervix. This is the cervix. This part of the cervix which open into the vagina is called external os, and the part which open into the uterine cavity is called the internal os. Internal os. Again, the position of the uterus is anti-flex, anti-everted. Anti-flex, anti-everted. Again, this is the anterior part, exterior genitalia of the female. This is the posterior aspect, the rectum. This is the uterus. This is the fallopian tube, and this is the left ovary. This is the right ovary and right fallopian tube. When we divide these mannequins into 2 halves, this is the left half. This is the uterus. Again, this is the left ovary. This is the left ovary. The ovary is the site of production of oocytes, site of oogenesis. The other function of the ovary is to produce sex hormone in female. Sex hormone in the female. The blood supply of the ovary by ovarian artery or gonadal artery, similar to the testicular artery in male, are branches from the abdominal aorta, usually inferior to the renal arteries. Regarding the venous drainage, the right one is drained to the inferior vena cava, the left one is drained into the left renal vein. This is the fallopian tube. This area, this mannequin represents the fallopian tube. The fallopian tube has 3 parts, or some textbooks 4 parts. The area close to the ovary is called the infundibulum. In the infundibulum we will find the finger-like structure is called the fimbrium. The dilated part of the fallopian tube is called the ampulla. The ampulla is the site where the fertilization occurs. The last part which enters the uterus is called the isthmus. Again, the parts of the fallopian tube are the isthmus, the infundibulum, the ampulla, infundibulum, and the fimbrium. The first part, in some texts, is called intramural part. So the parts are isthmus, ampulla, infundibulum, and if force, we will add the intramural part. This structure represents the round ligaments of the uterus, which connects the uterus into anterior abdominal wall. The round ligaments is one of the contents of the inguinal canal in the female, and this structure represents the ovarian arteries and ovarian vein in this mannequin. This is another mannequin represents the female organs. This is a uterus. This is the fundus of the uterus. This is the body of the uterus. And here we will find the cervix of the uterus. This is the cervix, and this is the vagina. This is the external os, and this is the internal os. This is the broad ligaments, represent the broad ligaments of the uterus. This area represent the uterine artery, which is branched from the internal iliac artery. This is a right fallopian tube. This is a left fallopian tube. This area in the yellow color is the right ovary, and this is the left ovary. This is the left ovary. This is the uterine cavity. This is the intramural part of the fallopian tube. This is the isthmus of the fallopian tube. This is the ambulofallopian tube. This is the infundibulum and fimbrium of the fallopian tube.